Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel. I hope you are doing well. It's obvious from the heading that today I will discuss about hypercortisolism, which is also known as Cushing syndrome. The objectives of today's lecture include 1. What is Cushing syndrome? 2. What are the causes of Cushing syndrome? 3. How will you investigate Cushing syndrome? 4. What are the treatment options for Cushing syndrome? Okay. Moving on to the first objective of today's lecture, what is Cushing syndrome? It is a characteristic group of clinical manifestations caused by excessive circulating free cortisol. Okay. What are the causes of Cushing syndrome? There are broadly 4 causes of Cushing syndrome. 1. Overproduction of adrenocorticotropic hormone from pituitary gland. This condition is called Cushing disease. 2. Overproduction of glucocorticoids autonomously in the adrenal gland. 3. Ectopic production of ACTH from lung cancer or carcinoid tumor. 4. Overuse or chronic use of prednisone. So, remember these 4 causes: overproduction of ACTH from pituitary gland, hypercortisolism from adrenal gland, ectopic ACTH production from lung cancer or carcinoid, and misuse of glucocorticoids. Moving on to the clinical features. It includes 1. Fat redistribution, which manifests as moon face, truncal obesity, buffalo hump, thin extremities, and increased abdominal fat. 2. Skin changes. Skin changes include abdominal stria, easy bruising, decreased wound healing, and thinning of skin. 3. Hypertension. 4. Polyuria from hyperglycemia. 5. Erectile dysfunction in men. 6. Menstrual disorders in women. Okay. How will you investigate Cushing syndrome? There are 2 types of tests. First, to establish the presence of hypercortisolism, and second, to establish the cause of hypercortisolism. To establish the presence of hypercortisolism, the best initial test is 24-hour urine cortisol level. Elevated 24-hour urine cortisol confirms hypercortisolism. Second test is 1 mg overnight dexamethasone suppression test. If suppression of morning cortisol level occurs, hypercortisolism can be excluded. It is not best initial test. if 24-hour urine cortisol level is available in options. Point to be noted. Because there are some conditions which can cause false positive results. These conditions include 1. Depression, 2. Alcoholism, 3. Obesity. When it is confirmed that hypercortisolism is present, then you will try to establish the cause of hypercortisolism. Serum ACTH testing is the best initial test to determine the source of hypercortisolism. Low ACTH means an adrenal source, but if ACTH level is elevated, the source could be either from pituitary gland or ectopic production from lung cancer or carcinoid tumor. Now, you will advise high-dose dexamethasone suppression test. If ACTH level suppresses, then the source is pituitary. If dexamethasone does not suppress ACTH, then the source is ectopic production. After that, advise CT abdomen for adrenal source localization, or advise MRI brain for localization of pituitary adenoma, or advise CT chest for lung carcinoma. What are the other effects of hypercortisolism? Cortisol is a stress hormone that is an anti-insulin. In addition, there is some aldosterone-like effect of cortisol that has an effect on kidney's distal tubule of excreting potassium and hydrogen ions and absorbing sodium ion. These effects result in hyperglycemia, hyperlipidemia, hypernatremia, hypokalemia, metabolic alkalosis, and leukocytosis. Coming to the treatment options, the rule is to treat the underlying cause. If the source is pituitary gland, the treatment option is transpenial surgical removal of pituitary adenoma. On the other hand, if the source is adrenal, then remove it by laparoscopic surgery. When hypercortisolism cannot be cured with surgery, give mifepristone. Mifepristone inhibits cortisol receptors throughout the body. Moving on to the last section of my today lecture. It includes questions. 1. Which metabolic abnormality occur in Cushing syndrome? 2. What two electrolyte abnormalities occur in Cushing syndrome? 3. What is the single best initial test for diagnosis of Cushing syndrome? Give your answers in the comment section below. This was all about today's lecture. Thanks for watching.